My portion of the presentation is on tapeworms, and you can get tapeworms one or two ways. You can ingest them as eggs. Say a pig had tapeworms, and he can excrete those in his feces, and if he excreted them onto the soil and we ate food from that soil, you can get it that way. Or you can ingest them as larvae, and larvae can attach and adhere to the muscle fibers in animals. So if we eat a steak that's raw or undercooked, we could get tapeworms. There's 4 kinds of tapeworms. There's the pork tapeworm, the beef tapeworm, the fish tapeworm, and the dwarf tapeworm. And the dwarf tapeworm is the only one that can complete the entire life cycle in one host. And so it can live up to your body for 20 years and can grow as long as 50 feet long. And this is the most common tapeworm in the world and can be transmitted from human to human. A lot of times if you have a tapeworm and it stays in your intestines, you're most likely not going to experience really many signs and symptoms. You might have nausea, weakness, fever, diarrhea. You might experience some weight loss and some nutritional deficits. But if the tapeworm migrates to other parts of the body, the symptoms are going to be more severe. You might have fever. You might feel cystic masses or lumps. You might, if it goes to your brain, you might experience seizures. You might also experience allergic reactions or bacterial infections. And also with both of these, in your stool, you might notice little segments of the tapeworm. Treatments include, well, depending on the severity, treatments might include just the inspection of your stool. You might also get a CT or MRI to help rule out other diagnoses. Some medications that they use are biltricide, albenza, and niclosamide. And it is very important to finish these medications. And if also it's very severe, you might have an anti-inflammatory medication prescribed for you. And those at risk for developing tapeworms are those who live in areas where poor hygiene is practiced, and that are developing countries where they have poor sanitation, where there's exposure to livestock, and then eating raw and undercooked meats. So a lot of these can be prevented easily just by taking proper hygiene measures, like washing your hands, before you eat, washing and cooking fruits and vegetables, thoroughly cooking your meat all the way, and like with fish and sorry. With fish and meat, like you can freeze it for like 12 to 24 hours to kill the larvae of the tapeworms, just as a preventative measure. And also, if you are in an area where there's a lot of livestock, disposing of their feces properly is very important. Also, you want to just avoid eating the raw or undercooked meat. And also, if you have an animal like a dog or cat in your house, and they have tapeworms, you want to get them treated promptly. And another thing is you need to be very careful if you're taking medications to get rid of the tapeworm. It will attack the tapeworm, but it will not attack the eggs. So you'd be careful to not reinfect yourself and to stop the infection by wiping properly and washing your hands afterwards.
Is that the end?